Today's podcast is really special. More than 47% of the pregnant women who birth in Indian private hospitals are going for a cesarean section. Whereas World Health Organization recommends that ratio to be under 20%. Many advanced countries like USA and so many European countries, the rates of C-section are below 25 or 30%. What is going wrong terribly in India? I'm sitting right now in Hyderabad, Telangana, where the C-section births in private hospitals is more than 80%, number one in India. To answer all of these questions, we have Dr. Evita Fernandez here today. Dr. Evita is the MD and Chairperson of Fernandez Hospitals. If you are from Hyderabad, you probably might have born in their hospital, or your parents might have been even born here. Fernandez Hospitals started in Hyderabad in 1948 as a two-bedded clinic and right now delivering 10,000 mothers every year. It's not about the numbers, but they are delivering the mothers with respect, dignity and promoting natural birthing. In today's podcast, Dr. Evita is going to talk about respectful maternity care. How do we even get that? Informed decision making. How can we do better decisions while we are birthing? And she also touched upon a profession called midwives and how they can make the birthing very, very smooth. This podcast, every couple in their pregnancy should really watch, and it can be an eye-opener. Do watch it till the end and it's going to be really, really insightful. Fernandez Hospitals. If you are from Hyderabad, you definitely might have the name. You probably might have taken your birth there, and not just you, your parents also. Started in 1948 as a two-bedded clinic. Today, Fernandez Foundation is delivering 10,000 couples, 10,000 birthings are happening there every year. It's the inspiration is not just in the numbers, but how each and every couple are treated with a compassionate care and an informed decision making. So we have Dr. Evita, the visionary behind what Fernandez Foundation is today. Welcome, Dr. Evita.
Thank you. And you're very generous with your sentiments. Gosh, you're embarrassing me, but thank you.
I know you would not like praises, but I have not started your introduction yet. Would love to do that too. Dr. Evita is the MD and Chairperson of Fernandez Foundation. She's the visionary behind what Fernandez Foundation is today. She's a strong advocate of natural birthing and non-medicalizing birthing and pregnancy. Dr. Evita, I know you would not like praises, but I should say you're a true blessing to the society. And your energy is really inspiring. It didn't stop only with informed decision and respectful maternity care. You encourage midwifery in private hospitals. You started training and empowering midwives to do a good job in their career as well. So it's a true honor to be in front of you and asking these questions today. I'm sure this conversation is going to be really, really helpful for all the viewers.
Well, thank you, Ravi. To me, it's a privilege to be here.
Thank you.
I mean that.
It means a lot. The first question I want to ask Dr. Evita is, you are a strong advocate of something called respectful maternity care, which most of us don't even understand what the term is. Can you please explain to everyone what is respectful maternity care? And do you think as a society in India, are we getting respectful maternity care today? And what is the difference between a standard care people are getting today and a respectful maternity care?
Thank you. That's quite a tough question, and it'll probably have to be followed by a bit of a lengthy answer.
Right.
We didn't probably way back term it as respectful care. But I go back to my mother. I remember she was very, very, very particular that a woman is covered and her dignity remains intact. She believed a lot in privacy.
Right.
So curtains were always surrounded, when she examined somebody.
This was back in 1950s.
Yeah, 60s. We're going back to the 70s.
70s.
Because I was a medical student, right. And that's when I sort of saw her. And that made such an impression on me.
Right.
The way she spoke to the woman, the respect, the keeping her privacy, dignity intact. Then I had the privilege of going to England and spending 13 months. And more than obstetrics and gynec, what I learned was the way you communicate with a mother.
Yeah.
The honesty with which you speak,
True.
the way you listen,
Yeah.
that made such a deep impression on me. So when I came back and I had to take over the reins, these kind of just flowed very naturally.
Right.
So I didn't think we were doing anything different, to be honest.
Yeah.
It's only when I sort of went into other places and then when I looked back on my postgraduate days and how we treated women, it struck me that, oh my gosh, there's a lot we have to learn, unlearn, and be prepared for that change. Then, my passion for teaching and reading. So as I began to read, and once I started midwifery, the whole philosophy of midwifery rests on this very basic foundation of respectful care. Then all the dots kind of got connected.
Yeah.
And we said, good God, this is something we believe in so strongly.
Yeah.
And after that, we never looked back. We said, we have to be strong advocates for this.
Right.
Not that we had it perfect in Fernandez. We still struggle with it because we get about 20 postgraduates every year.
Right.
They come from different backgrounds.
Yeah.
So to get them to even introduce themselves,
Yeah.
to say, look, tell the person who you are.
Yeah.
That is a sign of respect.
Yeah.
Because she would want to know who you are.
True.
If you're a trainee, say you're a trainee. If you're a consultant, say you're a consultant. You've established expectations in one sense.
True.
Just to get a young doctor to say, good morning. People are not used to these very simple, basic courtesies. Now let's go a little higher. To ask a mother, what would you like, at your birth? Who would you like to have with you?
Right.
And then to discover different things. So we call it birth preferences. We don't use birth plan. We say, what are your preferences? But all this, Ravi, won't make any sense unless you empower the woman.
True.
And tell her that these are your basic human rights.
True.
When it struck me, again, thanks to midwifery, that these were basic human rights of every pregnant woman. And we were denying them these rights unknowingly, because the way we were trained as obstetricians is to look out for emergencies.
Yeah.
And somewhere along our journey as obstetricians, we lost the plot.
Right.
While a major part of me believes that pregnancy, childbirth is physiological, it's natural, I would tell my mothers, please enjoy this journey.
Right.
Give this baby your best. Slow down. Talk to your baby. These sort of things I believed in strongly. But when it came into the birthing room, I realized that the childbirth practices we were taught as obstetricians, we had medicalized something so natural and beautiful.
Yeah.
And again, that's one form of disrespect.
True.
Not asking the mother, would you like to walk?
Yeah.
Not even encouraging the mother when she says, I want to sit up. No, lie down. Because we were taught that. So all this becomes part of respectful care.
Right.
And once you are convinced that this is the right thing, second, you realize what an impact it has on that woman for the rest of her life.
Yeah.
The bonding that happens between her and her baby.
Yeah.
When you follow all these aspects, including evidence-based practices.
Yeah.
Again, that's part of respectful care.
True.
Evidence-based practices.
True.
Just to give her baby, to let her hold her baby.
Yeah.
That's, again, her basic human right. What were we taught? Cut the cord, separate the mother and baby. And when I think of those days, oh my God, it never struck us
Right.
that we were actually causing such harm
Yeah.
Because today you realize that's such a vital part of bonding.
Very true.
So all these little changes that had to come in because they were the right things to do.
Yeah.
Once you do it, we never looked back.
Yeah.
And we realized that has to be our fundamental mission.
Yeah.
Everything we do has to rest on that foundation of respectful
care. Yeah. That's very inspiring. And it's so good to see you are actually walking the talk at such a large scale. And you're humble enough to admit, everybody have a learning curve. Things can't be perfect anywhere else. And Fernandez is also having that own journey. Dr. Evita, I heard you once saying, a woman can never forget the memory of birthing, right? How she is treated, etc. Today, we have advanced medical facilities, great doctors, 7-star ambience in many hospitals. But so many things are going wrong as well. The C-section rates are staggeringly high, and not majority of them are having pleasant birthing experience. So what do you think is going wrong today in general in during birthing in private medical care in India?
I think, Ravi, we need to rewind a bit. The reason and this is purely a personal opinion, what I discovered through Fernandez, if you want to give a proper maternity and newborn service, you need to do it with a team that provides 24/7 cover. If I'm a very busy clinician and I'm seeing 60 odd mothers in my outpatient clinic, in between I'm called for a birth. And as obstetricians, we thought the best part of birthing was to catch the baby. And we thought, wow, we did great. But again, midwifery has taught me that birthing is much more than that. And obstetricians play a very small role in labor and pregnancy, in labor and births. So it begins first with a change in our attitude.
Unlearning.
Okay.
Right.
So a mother needs that constant care and support from the time she sets into labor till she births her baby, till she's comfortable holding her newborn, breastfeeding her baby in that first 1 hour. We generally wait for an hour for the mother to settle down, make sure she doesn't bleed. So that constant cocoon of care during her labor and birth is vital, right?
Right. And that too, as a team only, it is possible to say. Right.
If I'm wanted in the OP, will I sit 8 hours with a mother?
Not practical.
That would be impractical and also probably a waste of my time.
Very true.
Whereas you have a midwife who's trained to global standards, who's responsible for the lives of the mother and the baby, and midwives are looking after mothers without complications. So you work as a team with mutual respect and trust. So the woman says, you tell the woman, you are in the hands of my colleague. She's going to be there with you. I'm there as backup. I will come in if I'm needed. No problem. Now that level of honesty and you marketing or building your team and telling the woman that you trust your colleague, all this makes a difference. So trust is built. And that mother then is happy to birth with the person that she's been assigned. So that teamwork is important. When that teamwork is there, then even if I'm called at 2 a.m, I am making a proper decision. Not because I'm tired, but I am wanted, then I use all my faculties. So the chances of me doing a cesarean because I'm tired all day, I need my sleep at night. So by 8 o'clock, if this woman doesn't birth, I have to do a cesarean. So there are many factors that will operate because I'm only human. I can't be my best 24/7. I think the fundamental flaw is the way we offer care to our women today.
So lack of teamwork.
One is teamwork.
Yeah. And
Two is the lack of working with midwives. Because we complement each other, Ravi. We are trained as obstetricians to look after complications. A midwife is trained to look after healthy mothers. Now, when you have a mother who's got a complication, we work together. She can't be denied midwifery philosophy of care when she comes in labor.
Right.
But I'm there as a backup. We make decisions jointly. Let me give you an example. A woman who's had a previous cesarean, now she's empowered. She says, I want to have a normal birth, Dr. Evita. I said, okay. She's come for childbirth classes. She's full of confidence. Now, she goes one step further and she's challenging me now. She says, can I have a water birth? Oops, okay. Previous cesarean, water birth, okay. Now we need to work together even better. So the midwives are there to support her. We obstetricians are there behind. And to be able to give this mother that experience, listen to what she wants and do it with conviction, because you've got this excellent team spirit of respect and trust.
Right.
The mother wins. And when she has a beautiful birth experience, wow, that changes everything.
I think society, yeah.
Absolutely. Yeah. See, we are privileged to be birthing the new humanity, as my good friend often says. And I'm so conscious of that. If we don't get birth right at the beginning, we've screwed up for the rest of her life.
Yeah, those memories are always there.
Because when a mother, what she remembers, Ravi, is not the frills, not the granite, nothing. What she remembers is how was she spoken to? Was she listened to? Was she involved in decision making? Was she supported? Was the team honest? I think it's these things that we fail miserably. I realize to my horror that we are so patriarchal in the way we deal with mothers who come to us. How many of us are willing to answer uncomfortable questions?
Like?
You know, a woman will say, Doc, what's your C-section rate? Doctor, do you believe in natural birth? Now, if I didn't know anything about natural birth, I would say, I'm sorry, I'm not really familiar with that. I may have to do some reading and get back to you. Like one woman asked me, Doc, I'd like to have a lotus birth. I said, I have no idea what a lotus birth is, but let me check it out. And if that's something we can offer you, I would give you my best. I think people want us to be honest. And I don't know how many of us are willing to go that far. So when you talk about a rise in C-section rate, for me, the first thing is lack of team, 24/7 care, lack of protocols, and our belief in not giving the mother evidence-based practices. You know, I worry about, let's take another example, induction. At Fernandez, we get absolutely worried if we have to induce a mother, because our data has shown very clearly if a mother is induced, her chances of a cesarean get increased.
And some doctors don't even take a consent before inducing even.
Well, I don't know about that, but at Fernandez, you cannot induce without first talking to the mother,
right,
telling her what it means. And the whole process itself at times can be demoralizing because you may not respond. Then they get, worried. Then the family gets involved and say so many hours. why don't you do a cesarean?
Right.
The pressure builds up. I mean, there are all these things that kick in.
Yeah.
So we would prefer mothers setting into birth spontaneously. So then again, that brings you to the third reason. How many of us are prepared to wait for natural labor to begin? Sometimes it could be fear.
Right.
Fear of the unknown. Sometimes it could be that you're the sole practitioner. You may not want to wait and take that risk because you don't have the infrastructure to monitor that mother, or to have an anesthetist ready, or a pediatrician on call. So all these things would influence. I know that it's said that finance plays a role. I'd like to believe, Ravi, that my obstetric fraternity is not doing sections only for the sake of
Very
money.
true. It's a
I'd
larger...
like to believe that that's not on top of the list. There may be a few who may do it, but I would put that as my last reason. For me, it's the fact that most times you're a solo practitioner.
True.
And to take that risk with that baby, no, I wouldn't. I would probably end up having a higher C-section rate if I'm a solo practitioner. That's the luxury we enjoy at Fernandez. That 24/7 team care, and that the mother doesn't have to have the doctor of choice, because that's something we tell every mother up front. We work as a team. When you come to birth, you may not have the doctor of your choice, but you will have a team that is competent, and the doctor that you have been seeing will be informed of your care. And I think that level of transparency
Very true.
creates trust.
And end of the day, it's all about the best outcome for them.
Absolutely.
The whole reasoning is to make that happen, so people are happy if it is disclosed at the...
Absolutely. The more transparent and honest you are, the easier it is to offer care.
Very true.
At least this is what I have learned over the years, to be upfront. Finally, I need to be able to sleep well at night. Once you have the evidence staring in your face and you don't offer that care, then you know somewhere in the recesses of your heart, your conscience, that you're not doing the right thing by your mother. And if you are placed in a leadership position, Ravi, you have to walk the talk. To me, that's one of the most difficult aspects of leadership. To lead by example. There's no other way you can do it.
That's so beautifully put, Dr. Evita. And we speak to so many mothers as well. Thanks for breaking that one common notion. Many people think the staggering C-section rates are because of profit element only. And one of my dear friends who's a very good doctor, I don't want to quote, he says the higher C-section rates are primarily because of obstetricians' distress, not that obstetricians want to make more money. And thanks for pointing out on system as well as how midwifery-led care can bring that down and improve the quality.
I could substantiate that. When you look at Bogulkunta,
right,
where we have our midwifery-led unit, we've had, I think, roughly about 1,700 women, and these are very carefully chosen, healthy mothers. Our C-section rate is 5%.
In Telangana, where C-section rate is 80+%.
No, I'm talking about a selected group,
right,
healthy mothers, no complications, setting into labor spontaneously, who have been seen by midwives all throughout. Some of them may have seen an obstetrician during antenatal care, but when they come in labor, they are again assessed. And so if they come into that category of being low risk, they are cared for by midwives. And the C-section rate is 5%.
Wow.
To me, that's proof enough
True.
that these mothers are better cared for by midwives. We take care of mothers who need us. Like if a mother is not able to birth, she needs assistance. So I can go and apply a forceps. And I should be able to do that beautifully with minimum damage to the mother and the baby. That's my role. And that's what I'm trained for.
Yeah.
I'm trained to, when a midwife calls me and says, Doc, I think this baby needs help. Then I assess the mother and I say, you know what? She will need a cesarean. Then the mother realizes, yes, I've done everything, I've tried everything, and my job is to convince the couple. Why do I suggest a cesarean? 1, 2, 3, 4. And there are what you call second stage C-sections. That's when the mother has gone through labor, the cervix, the mouth of the womb is completely open. You need to do a safe C-section because it comes with certain risks. I should be able to do that beautifully. That's where my role comes in. So if we obstetricians could open our minds, our hearts to working with midwives as colleagues, and with this team effort, mothers who come to us will get the care they truly need
And deserve.
and deserve.
That's so beautifully put, Dr. Evita. And thanks for proving it at such a large scale so that, every institution can be inspired from. I'm sure things are also changing and people are looking for more such care. People started asking questions.
Yeah.
On this note, just taking one step back, not everyone know about midwifery-led care. So would want, and nobody better than you can explain this. So who is a midwife? What's her degree? And how midwifery-led care is different from an obstetrician-led care? If you can just, if you can go one step behind, and if you can answer this, it'll be greatly beneficial for all the viewers.
Sure. Today, Ravi, when you use the word midwife,
Right.
doesn't matter which social circle you are in,
Yeah.
straight away you'll get a response, oh yes, of course, the dyes.
Very true. Yeah, exactly. I want you to burst that myth. Yeah.
My grandmother had all her babies. She had a midwife. And I say, well, today when we use the word midwife, we are talking about, in India, a nurse who has done her basic 3 years of diploma or her BSc. After that, she's had 2 years of experience in maternity services. After that, she's done 18 months of very, very high quality training because she has to meet global standards of competence. And once she passes that exam, then she registers as a midwife, which means she's capable of handling mother and baby, right? She's responsible for 2 lives. So to be a midwife, you have to be knowledgeable, highly skilled, competent, confident, communicative. So it's not easy.
Yeah, that's a very rigorous training.
It's a rigorous training. And that's why I say when you work with a midwife, it has to be a midwife who is trained to global standards. Now, what do midwives do? They take care of pregnant women who have no complications. And if you look at these women, majority of them will set into labor spontaneously. And a midwife empowers a woman. She prepares her for childbirth. She tells her how to handle the pain of childbirth. She prepares her with exercises. So this woman, when she comes in labor, she's empowered.
Very true.
She's confident. And remember, the husband or the partner, whoever the mother chooses to have as a birth companion, is also being educated and empowered. So now the scene is shifted. You've got a mother who's confident. She may not even ask for an obstetrician. She comes into labor, she's given this incredible support. She births beautifully. So if you have a midwife and a team of midwives to take care of these mothers, the obstetrician has more time to give her best to the women who need her care. Example, if I see a mother in my outpatient clinic who's had 3 pregnancy losses, I can't talk to her in 20 minutes and say, okay, next patient. I can't do that. I have to talk to her about what happened, what are we going to do. If she comes pregnant, she's going to be terribly nervous. So I would have to give her a little more time than somebody else. So this kind of collaborative model of care gives the obstetrician time to focus on what we are trained to do. So a midwife is a very responsible, accountable healthcare professional and an expert in normality. So when she's with a woman in labor, if there's even a slight deviation, she picks it up.
Yeah.
And immediately responds. If she finds that there is a sign that may suggest a development of a complication, she will either respond to it or send for help to a doctor. If a midwife is working in a primary health center, like in Telangana, she's trained to recognize complications and refer the mother in time. So the mother then can go to a district hospital, area hospital. This way, the midwife reduces morbidity and death of both mother and baby. So you see, Ravi, we need midwives and obstetricians to work together. I rest my case.
That's a no-brainer, and it's not like it's not happening elsewhere. It's happening everywhere. I want to give an example. We have community of to-be moms, to-be parents, I should say, across the globe. One birth story, one lady from US, she's an NRI, she wrote that I'm in labor for 4 days. My midwife was very supportive. I was moving, I was eating, and they didn't induce me. They felt no need. And end of the day, I had a beautiful vaginal delivery. It's a complete cultural shock to, Indian parents who are reading that. Who is that midwife? Why somebody allowed to be in labor for 4 days? Here, 37, 38 week, people are asking, oh, you're not delivering yet? We have to induce and, maybe we should get that soon. On that note, I want to ask a question. It is a proven model in developed countries like US and many European countries. And their C-section rates are below 25%, 30%. Why India has failed to adopt this model? And I don't think anyone apart from you doing a job to train midwives and create more midwives at the scale you're doing. Why we as a society and country has failed to adopt this model? What are your thoughts on that?
So you asked, Ravi, why is it India has not adopted? Now, there are 2 ways of looking at it. One, remember, for the last probably 60 years and growing more in the last 20 odd years, it's a very strong medically led maternity practice. Women are used to seeing doctors, except in places where there are no doctors, or in our public hospitals where there are so many women birthing, you don't have enough doctors. So nurses have doubled up and, in some places you also have other professionals helping, medical students and things. So it's a very strong medically led practice. And suddenly to introduce a whole new cadre, you'll get questions and you can't deny that. The nurses will say, oh, we've been delivering mothers, what's so special about midwives? Obstetricians will say, well, if they're going to do everything, then what do we do? Because if you've not seen a real midwife, I'm talking about as we understand today, the definition that I gave you, then it's very difficult for a nurse, for a hospital administrator, for an obstetrician, not so difficult for a woman, but for these three areas to say, what's so great about midwifery? So that's why, that's one of the practical issues.
So it's a mindset,
It's
mindset issue. Yeah.
But once the government decided, let's have midwifery across our public hospitals, and where in those states where you've actually produced clusters of midwives and posted them in high volume settings, you can see the impact it has had on women. Women in our public hospitals have embraced midwives because they realize the first thing, they're getting respect, compassionate care, their dignity is preserved. They are encouraged to bring a birth companion. The poorest of our poor women in some of our Telangana public hospitals are birthing in positions of choice.
Which is the luxury many private hospitals doesn't give.
Private hospitals, we don't offer that.
Except for Fernandez.
Well, Fernandez is learning still to do better and better. We still have a long way to go. We don't have enough midwives for all our mothers. But the fact is, wherever you have these midwives in public hospitals, change is happening. Because young obstetricians who are there at nights see this. Now they're getting on to the bandwagon. So they're asking our midwives, hey, how do you do that? Can you teach us to do that? So slowly, the philosophy is expanding. I have hopes. I'm an eternal optimist. I may not be around to see this change, but it will happen. Because more and more obstetricians are beginning to see the impact of midwifery care. While it's starting in the public hospitals, slowly it will come into private sector because women are asking. And then the whole country will have enough midwives. It will take us...
True. I think when the demand raises, supply, we are bound to bring this.
Absolutely.
Yeah.
Absolutely.
And you are the one who started this change.
I claim responsibility for that, Ravi.
The scale.
The government,
Government, of course. You should credit.
midwifery.
Yes.
No, there have been others like Prakasham, who brought in the concept of midwifery into India. Fernandez cannot claim to be the pioneers, and I would refute that. We are just privileged to sort of come into the scene because we piloted it in Fernandez for a good 4 or 5 years. So we had a lot of learning.
True.
And once we were convinced, we were ready to train wherever there was a need. The only sadness that I feel today is, why am I not able to push this into the private sector? I wish my obstetric fraternity would embrace it, because at the end of the day, they would be happier.
Yeah.
Because they would see the joy in the mothers that they are privileged to take care of. Just that initial fear needs to be, gotten over. Then I think it'll, the dam will burst. I'm waiting for that day.
You humbly said you don't want to take the credit of bringing this. But as an entrepreneur, I believe in scale. Scale creates a lot of impact. Today, when I speak to so many obstetricians at Fernandez, they embraced it. And they're loving, they're getting the satisfaction of giving the best to the couples. And they're happy with working their midwifery colleagues. And they are being advocates in their own communities. And the new set of doctors, like a millennial obstetricians, I see most of them they're very much open to holistic interventions, midwifery-led care, respectful birthing. So I think the seeds that are being sown, and nobody can't deny the impact that Fernandez created in bringing it to scale. Sure, the next generations are going to reap the benefits. And I also wish with my whole heart that, the next generations get more quality care.
I'm confident, Ravi, that the next generation will get it, because the younger obstetricians are open to it. And at Fernandez, I think the privilege we've enjoyed is we are a hospital, and I guess in that sense, the only hospital in the country that's training midwives and working with midwives in large volume settings. Because India is a place where you have high births. Come on, we can't have small birth centers. That won't be the answer for our country. So Fernandez decided to focus on how do we offer midwifery philosophy of care in large birthing volumes, because that's what India needs. I'm confident in the next 10 years, this will change dramatically.
I'm also very optimistic about that, and I really love the term you coined about your optimism. So yeah, looking forward.
But thank you for people like you who are raising awareness, who are equally passionate about this. Yeah.
Thank you so much, Doctor. So not everyone is privileged to birth at Fernandez. People are in other cities also. So I have one question on behalf of all of them. During the birthing, there are so many things. Obviously, normal couples are not medical professionals. They don't understand most of the things. How they can take better decisions. They are put through so many situations. Should I induce you? Okay. Should I give epidural? Right? Or no, you have to go for C-section only. These things are said like there is no choice. Okay. So how they can take better decisions for themselves while birthing is happening, before birthing or post birthing?
Yeah. Thank you. One is, Ravi, if I'm a care provider, my duty is to empower that woman with all the information. When I was in active practice, and long before we started childbirth classes, I would give my mothers links to go and read and say, go get all the information. And when you come next time, come with your list of questions. Because then you would have read something, you would have understood, then you can ask me all the questions. Now that gives the woman a lot of confidence that I'm not scared to answer any kind of question she wants to know. But those questions will come only if she is empowered with knowledge. So that's important. Once she gets the right information, then she can make a choice. If I tell you that your baby's heart rate is dropped, you need a section. If you're empowered, you'll say, but I can hear the heartbeat. It's normal. I can feel the movements. Or why do you say that I need a cesarean? You get mothers today who will ask you, and I love
They're asking those questions. Yeah, it's brilliant. Yes.
I'm so grateful to those mothers who challenged me every time, because they really made me think and made me, the person I am today. So, how many of us are prepared to take that risk? So, it takes, again, a change in mindset. So, once mothers are empowered, they've been doing their reading, they come for childbirth classes, they know that induction is not the best answer to everything. You have mothers who will ask, Doc, can we wait 3 days? And I have colleagues who will say, but the protocol says you have to be induced. But Doc, my sugar is normal, my baby's moving, I get a good feeling, I know that I'm fine. Please, can we wait for 3 days? And I actually feel terrible that a woman has to ask for this, and depending on the level of experience and confidence and the data that you've had in your hospital would influence your answer. Now, if I've reached a level of confidence where, yeah, I can trust this mother, her instincts, let's go along with it. But we have some, let's sort of have a frill of safety. So I'll probably tell her, okay, let's wait 3 days, but make sure you count the movements of your baby. If you have any problem, make sure you come in. Can we trust each other on that? Or can we listen to your baby's heartbeat or do a CTG tracing on the 3rd day? I may negotiate for something for my own peace of mind, but I'm willing to give her those 3 days. And sometimes these women may just set into labor on the 3rd day and have a beautiful birth. But if I'm rigid and I say, no, protocol says 38 weeks, but why, doc? No, our data shows that our risk of having a stillbirth is this. And that is honest data. Then the couple may say, okay, doc, we'll go along with you. But there's a level of disappointment. We've got the good side and the bad side. And taking that informed decision demands honesty from both sides and willingness to take that risk, knowing full well that everything has been explained. God forbid, if something should go wrong, then the couple most times will forget this conversation. And that is the risk that not many of us may want to take, Ravi.
You mentioned about informed decision making. What does that mean? And how couple can get benefit from that informed decision making in their journey?
Yes. Now, informed decision making is, let's take a case of a mother who's, say, 39 years old. And according to the definition, which I hate the term, advanced maternal age, I think these words should be deleted from our environment. And studies seem to show that mothers, if they go beyond 40 weeks with this age group, there's a slightly higher risk of a stillborn baby. Now, if you've got a mother who may be 39, let's say she's even 40, physically fit, does yoga, the baby is growing beautifully, the amniotic fluid is fine, blood glucose levels are fine. I mean, for all practical purposes, she's healthy. But your protocol says you need to induce her when she touches 40. Now, that informed mother will sit down and tell you, doc, I'm not comfortable. I'm fine. I'm prepared to wait another 3 days. I'm prepared to take that risk. Give me a chance. That's an informed decision. She's confident. She's listening to the doctor who's quoting statistics. She says, yes, but I may not be part of that statistics. I'm confident that I can do this. Give me that chance. Then you document it. You've had a very honest conversation and both are prepared to support each other with mutual respect and trust. How many women will do this? How many of us doctors are willing to listen? I really dream of that world, Ravi, where we can have these honest conversations and willing to walk with women. It's not easy. Sometimes things can go wrong. And that's when it can get difficult. Most times things work out fine. It's great. But that's the risk you take.
Yeah. And in the defense of the expecting couples, they also like, how do I just be polite and also have these discussions with my doctor? End of the day, she's the one who sees me for my birthing, and I don't want to her to have, or him to have some negative attitude towards me, whatever. Like, I don't want that bond to be broken. So what do you suggest those couples?
A tricky situation, because I've listened to some of the young couples. And again, it depends on the trust that has been built up and the willingness of the obstetrician to take a step back, to be humble, to be open. Then it becomes easier. If I am willing to say that over the years, this has been our protocol, we've never done this before, I'm willing to take this risk with you, provided you know the risks involved, then that relationship doesn't get marred in any way. The point is, and I'm speaking from the obstetrician's point of view, it takes courage to do that, Ravi. And I would do that when I have a backup of my team. I'm not alone. Then I have a protocol in place. Then I know, okay, these are the risks we are taking. This is how we are following this woman. And as a team, we make this decision. Because these are decisions that are not easy. So in Fernandez, we actually work together. A consultant will say, I have a mother who's, challenging me. And not in a derogatory way, but I'm using the word challenging because these are challenging situations. So we as a group sit down and say, right, maybe we could do this, or we could walk up to this point, but beyond that, I don't think it would be safe. So you have the support of an institute, you have the support of other colleagues.
Yeah.
Because you are taking a risk, and these are very rare cases, I must admit. I think we have to be less rigid about using our protocols. Sometimes we may be making decisions just because it's convenient for us. And I think mothers can look through that. At the end of the day, I'm convinced what is demanded of us, Ravi, and as hard as it can be, is our honesty, our concern, and our commitment to doing the right thing. I think ultimately, this is what works.
Yeah, intent triumphs everything.
Sorry?
Intent triumphs everything.
Absolutely. Absolutely. Yeah.
Yeah.
Again, if you've had what I call an adverse clinical event, for the next few months, you would be very careful. Example, you have a mother who's had a previous cesarean. You've discussed all the risks. She signed up for it. She sets into labor. Unfortunately, the scar gives way. You rush her into the theater, but you're not able to save the baby. You've done your best. For the next 6 months, everybody in Fernandez is now worried. So the next mother who asks for a vaginal birth after a C-section, because that event stays in your mind. So all of us obstetricians would have had these challenging situations where you've done the best, but the outcome has been terrible. And it can put you back several steps. So when you're talking to mothers who challenge the protocol or the guidelines, it takes a lot of courage, if you're a solo practitioner, to walk with her. It's easier when you're working in a team, in an institute that's back.
And I think it also takes a lot of courage for someone in your position to share this in a so candid way. I think this is the truth. This is the honesty. There are a lot of factors involved in taking that decision at that point of time.
Yes, a lot of factors
Right.
involved. Because when you see things can go wrong, it does,
Yeah, it creates definitely an impact on the decision.
absolutely.
Doctor, thank you so much for talking about respectful maternity care, midwifery-led care, how midwives are playing an important role, and how beautiful outcomes you're seeing as an institution, and talking about informed decision making. I think this will really, really help put a perspective to all the viewers out there. I would say this podcast is not just for expecting couples, but for anyone who are interested in birthing and want to impact the society in a better way. One last thing I want to ask, what suggestions, you candidly, as always, you speak, any suggestions for the expecting couple out there?
Yeah. Thank you, Ravi. If I may just share a concern that I have, Ravi. While we offer childbirth classes to women, and these could be women who are not coming to Fernandez, who just want to be empowered. The only concern I have is, because I have no answer for this, is if they go to a healthcare provider who's not willing to let them exercise that knowledge or give them that space to enjoy their labor and birth as they should actually be enjoying it, then I feel terrible for that couple. Because in a way, I feel, oh my God, are we causing more harm?
By giving that information.
Yeah.
Yeah.
Because if you don't know what you're missing, you don't miss it.
Yeah.
But once you know that this is not how it should be, but I have no choice, then I feel terribly guilty about these couples. In Fernandez itself, sometimes things fall through the cracks, because just at that precise moment, if you've got a trainee doctor, because the midwife may have stepped out for something, or though they don't, or the doctor who's there has stepped out, and the way that answer has been given to that mother during her anxiety, could just be the trigger to create disappointment. Or her contractions may stop because of lack of sensitivity by the person in the room. So it's just a concern that I felt I had to share. So for couples who are pregnant, I would say get all the knowledge that you can. Choose your sources wisely, because there's a lot of information out there. There are some lovely websites, links, support groups that you can talk to. Find doctors who are willing to answer your questions. Ask doctors how they feel about natural birth. What are their views on induction? Are they open to having birth companions? Would they be open to a doula being with you in that environment? Because this is the most significant event in a woman's life. How she births, how she brings that baby into this world, how she's supported during that moment of childbirth is going to have an impact on her for the rest of her life, emotionally, psychologically, and in many other ways. It could also trigger postpartum depression. So my desire for every pregnant woman, wherever she is to birth in an environment where she's supported by staff who would respect her choices, who are competent enough to help her make wise choices, and that she births and feels good at the end of it. That's my sincere advice and prayer for every pregnant woman. And when women ask for this care, we will be forced to change. They would be helping the obstetric fraternity to think, to reflect, and produce that much needed change in the way we practice in birthing rooms.
That's a beautiful message. Thank you so much for that. Last but not least, we want to do one segment. We asked people around in the imams community. They have so many questions. They're confused and they want to know the answers before they're birthing. And I'm sure these are the questions many other people might be having. So I would like to ask some common questions they've written for you. Would you love to share your answer on this? Thank you.
If I can, sure.
So there is this question, what if my doctor says there are complications and we should hurry for a C-section at the last moment? At that time, how can we know whether should we wait or is it the C-section is really necessary?
Yeah, that's a tough one because you're most vulnerable.
Yeah.
Particularly if I'm a woman in labor, I've gone through pain, I've gone through anxiety, I'm anxious to give birth to my baby. And at that point, if my doctor tells me that there is a complication and I need to do a cesarean, if I have built trust in that doctor, then I would trust her without any fear. But if I have not been comfortable throughout my pregnancy, and I've kind of gone into this whole hospital and labor with a certain level of distrust, then if I come and tell you as your obstetrician that I need to operate, you're not going to be happy to say yes.
Yeah.
Then you need to exercise your rights and challenge me and say
I think
why.
firstly this question have come. This question would not have come if there is trust already.
Exactly.
But this is the most popular question.
Yeah, so somewhere there is a level of mistrust.
Right.
And if there's mistrust, then it's your human basic right to ask. You're well within your legal rights as a patient to ask, why do I need a cesarean? Can you explain to me? If it is what I would say, we call it a crash cesarean, where you have no time, you've just got to get the baby out, that's quite evident. I mean, even if you're a birth companion, you'll know something is happening. You would have seen evidence of it. The heartbeat would have probably dropped, or the woman is bleeding profusely. Things have changed in front of your eyes. Very, very rarely would a birth companion object to that kind of a decision. I don't think trust is a factor there.
It's evident.
Yeah, it's evident. But if I'm your obstetrician and I come and tell you when you're in labor and you think things are going fine and suddenly I spring this on you and you're not comfortable, you need to ask. I would urge you to ask.
Thank you, doctor. What is the ideal birth position and how do we decide what position works for us?
Yeah, thank you. There's no such thing as an ideal position, Ravi. What we do not certainly support is a woman lying flat on her back, as we were trained to birth women.
That's the most commonly followed.
Yeah, and that is a position we would never, never, never advocate. And a woman should fight never to be in that position. So I'm very clear about it. The ideal position is any position that keeps a woman upright. So she could be sitting in a squatting position, or she could be drawing her legs up, resting them on the bed, on the table that she's birthing, and her husband could be supporting her at the back. If she's comfortable in that position, that's fine. Most times, women adopt the position naturally, what they feel comfortable. What is important is that your care provider should be comfortable to birth you in that position. So Fernandez is actually coming up with a program. It's too soon to talk about that, but I am convinced if we can empower my obstetric colleagues to birth women in positions of choice, we will have a completely new experience for birthing mothers. And I'm looking forward to that happening. And Fernandez has some plans about seeing to that.
I'm super excited.
So then women will be comfortable with their healthcare providers because obstetricians will be competent.
Lovely. Lovely. Next question. How do we prepare our bodies if immediate breastfeeding is not happening? This is one concern everyone has. Will I have enough produce after I deliver? Will I have enough breast milk?
Gosh, that's an area that's really out of depth for me because we have lactation
You want to
counselors.
pass this question?
Yeah, I would pass that question. I would hate to give information that's not correct.
Does all doctors suggest to deliver during 37, 38 weeks in case of low birth weight? My doctor is suggesting the same.
Yeah. In case of a low birth weight, again, Ravi, it depends on what is the cause of that low birth weight. What are the other factors operating? Is this baby just small, but is this baby small with less fluid for the baby to move? Then the chances of the cord getting compressed and harm to the baby would be there. Is this baby, does the mother have high blood glucose levels? So a lot of factors would influence that. So it's very difficult to say, does everybody? Yeah, I would hate to make a general statement. If a mother needs to be induced, there are two clear indications. Either the baby's life is at risk or the mother's life is at risk. These are the clear indications when you would want to induce. Anything else, you'll have to think.
And you also mentioned induction increases chances of C-section.
Our data at Fernandez has shown this very clearly.
Right.
A woman setting into labor spontaneously, her chance of having a cesarean is minimized. Yes.
What should I do if my doctor is very persuasive and not allowing my preferences?
If for me, my birth experience means the most important event in my life, then I would change my healthcare provider. Because to me, that is the most important event. And I want it to be the best. So I'll look around, I'll ask, I'll find out. I mean, I know women who travel and go and live in the village, Priyanka, birth village.
Yeah.
I've visited her place. And I have a lot of respect and admiration for the work she does. And couples come from all over, as far as Nepal. And they come and they live in houses so that they can have that birth that they want to have. Now, to me, that speaks volumes. So women want their birth experience to be joyous, to be blissful. And we obstetricians who are privileged to serve these women need to look at birth in that manner. To me, we need to listen. We need to listen to the voices of the women we serve. By listening, I have learned so much. I have been brought down to size just by listening to what women want and what they have felt about their birth experience. Even when I was the obstetrician, it was huge learning. And I realized at Fernandez, we had to change our childbirth practices. That's the most significant event, for God's sake.
I'd rather say it's a personal question. So you mentioned you've been vocal that you started as a young successful obstetrician and you had to unlearn so much so that you can start respectful maternity, embrace midwifery philosophy. What actually changed, doctor? Like why your perspective shifted and why you became so passionate about creating such an organization on that fundamentals?
Yeah. My journey, I'll have to rewind a bit. My journey to midwifery began because I wanted to reduce maternal deaths. And countries that adopted midwifery as the strong cadre, their maternal deaths are single digits. Look at Sweden, Netherlands, UK. So I began to look at midwifery and wanted to pilot a small group in Fernandez to understand what a midwife is, what is the curriculum, what is it they're taught, how can we work together. When I began reading about midwifery and normal labor, physiology of normal labor, the whole philosophy, I realized we don't do any of this as obstetricians. And I thought, good God, this is really what we should be doing. In 2007 or 8, I had invited Nutan Pandit, whose book I used to prescribe or suggest to mothers. While I believed pregnancy and labor are natural events, when Nutan took a class, I said, Nutan, can I hear you? And I realized whatever Nutan was talking about, practices in labor, we were not doing it in Fernandez. And I thought to myself, Evita, you're such a hypocrite. You're suggesting the book. You're telling mothers that this is normal. I had mothers swimming because I encouraged them. I had mothers walking 5 kilometers. So, physically I was getting them to be fit. But in the delivery room, our practices were archaic. That shook me up. And I said, no, this needs to be looked into. And the midwifery journey just brought it into, connected the dots, if I may say so. And I realized, we need to change. So we did a 180-degree turn.
Yeah. I'm an entrepreneur and what you have done is super inspiring for me as a person, what you have done to the society, but what you have done as an entrepreneur, the thing, your parents started this, you have scaled it like 10-fold, 100-fold, from a 40-bedded hospital to a 320-bedded hospital is what the stat I read, I'm not sure if I'm right. That is super inspiring, right? So in this journey, you also turned Fernandez to a non-profit foundation. And every year, Fernandez is writing off crores of worth bills and never denied anyone the care on the basis of their purchase power. How that decision, that's a very hard decision for any organization to make. How did you steer the organization towards that decision? And why is the reason behind that? What is the reason behind that?
Yeah, I'm actually surprised that people keep asking me this question. To me, it seemed the most natural thing to do, Ravi, because my parents, it was a proprietorship, right, when my parents ran it. And they handed it over to me. And within 6 years, I realized that the 40-bed hospital wasn't enough. And after a lot of soul searching and things, the decision was made to raise the 40-bed hospital to the ground and build a 100-bed hospital, for which we needed a loan. Now, to get a loan to build a 100-bed hospital, the bank would deal with a company, not an individual.
Yeah.
So that's how we created the company. And my parents were the founders. And we never took any dividends. I mean, we just didn't do it. So I was an employee. After my parents passed on, their shares landed on me. And I just ran it like a not-for-profit. So whatever profit came, it just went back. And I continued to remain an employee. So when I was in my mid-60s, I thought, okay, after me, what? The legacy needs to continue. The not-for-profit philosophy needs to continue. And we need to continue giving back to the community. So I did it because I was convinced, I was passionate. I'm single. I had no huge problems to worry about. So how do I ensure this will continue? So I thought the best thing is to let's make it kind of legalize it. While it had the facade of a private limited, it ran as a not-for-profit. And I just did it quietly. I didn't make a big tamasha about it. But once I converted, everybody kept asking me, how, why? And I'm saying,
operationally, it was running as a spirit of non-profit all the
absolutely.
time.
So for me, it was business as usual.
Right.
Except that if I
The
converted,
tag had come. That's
yeah. So the income tax guy looked at me like I had two heads. He says, in my 40 years, nobody has done it.
Yeah.
My chartered accountant says, I told her, sir, I didn't told her to wait for 1 year, but she said, I said, look, I want the work to continue.
Right.
By registering it as a Section 8 company, I'm actually bringing in governance.
Right.
I'm bringing in transparency. I'm bringing in accountability so that nobody can siphon money into their pockets. And the money can be used,
Charity.
or to improve the work that you're doing, maintenance or whatever. So that's it. It's nothing extraordinary in my mind. Seriously.
Yeah. I don't have words. The spirit of service that you always carried, creating a venture entrepreneurially that is generating revenue and that is supporting all the good work that Fernandez is doing in supporting more patients who are from different socioeconomic background, the research, the education initiatives, everything. So hats off, Dr. Evita. Thank you for doing all the wonderful service for the society. Is it tough to run the business ethically? I'm sorry for using the word business. I mean, Fernandez never encourages common practices like giving a referral fee or don't spend much, very negligent or nothing, I don't know, on marketing and traditional sales channels. Is it difficult to run an organization and bring it to this scale ethically?
I never looked at it as being tough to run the organization ethically, because for us it was the most ordinary thing to do. We never looked at doing it in any other way, so it wasn't extraordinary. But today we realize the whole atmosphere has changed around us, and to sustain the organization continuing with ethical practices, it has become challenging. But again, I'm optimistic. While we would like to now, probably the time has come for us to market and to make ourselves more visible. And hopefully we will have discerning couples who will feel it's still worth traveling the many kilometers and come to us.
Absolutely.
I live with that hope while we work on other aspects of becoming visible. But we are very, very clear, Ravi. It'll only be ethical practices. And we will aim to be as honest as we possibly can with the women we are privileged to serve. I can't see us doing anything else. If we fade away after a few years, it wouldn't matter. because there's no way we would compromise on the non-negotiables. We can't continue to look at the bottom line only.
Yeah.
We've chosen to be doctors. We are a service, purpose-driven organization. If we don't give back to the community, then our work has no meaning. We may as well shut it down and sell out. It has no meaning.
Organization that's built on such strong principles, I feel it's bound to stay forever.
Well, we hope. We live with that hope.
One last question, Dr. Evita. I had the privilege to interact with so many obstetricians, administrators, so many colleagues of yours. They all they say how humble you are. You never throw your weight as an MD chairperson of such a large organization. You go wait at, whenever you visit other hospitals also, you go wait for your appointments, I mean, it might sound very normal to you being who you are. And they are really truly inspired by your leadership and how you walk the talk. And they even said that even if we get a 3x, 4x salary, then what we are paid here, we would never move. So how Fernandez as an organization inspired everyone across the cadre. So what worked for you? What do you think when you introspect?
Well, thank you for saying that, because I didn't know my colleagues look at me like that. I think I thought,
No, absolutely.
I thought most of the time
I heard
they're
so
frightened.
many stories.
Well,
Yeah.
that's humbling to know. No, I think what works at Fernandez, or I wouldn't say I think, I know what works at Fernandez, is we have leaders at different levels
Right.
across the organization. And I'm extremely fortunate to have leaders who walk the talk. Secondly, I'm blessed to have walking consciences. Anybody can walk into my room, sit across the table and say, things are not working out right. We are not walking the talk, challenging us. I think that is important, that people feel free to question and to ask uncomfortable questions. We're trying our best, Ravi, to make sure that every voice is heard. Because one of the fears I hold is every voice heard? Because it matters. There should never be injustice. If unknowingly we are doing things where someone is not getting the right acknowledgement, the right level of pay, the appreciation, then that needs to be brought out and tackled. So there are little things we're trying to do as an organization to bring in more unity, though, because we are expanding.
Yeah.
How can we work together as one? Those are the difficult things, that as you grow, that ability to stay as a family.
Right.
And so we're constantly doing various things. And I think another area that has helped is the connect with employees. Every week I meet with a bunch of people at different levels. Housekeeping, nurses, doctors, receptionists. And it has been absolutely heartwarming, because some of them have worked with us for 14 years, 18 years, 20 years, some as short as 6 years, 2 years. And they say, what keeps them here is the fact that we feel we are in a safe place. We are not asked to do anything that is wrong. We are respected as women. We are heard. Now that gives me hope.
Right.
And I think these are things that matter ultimately in an organization.
That's a masterclass you have given for all the entrepreneurs too, apart from expecting couples. Thank you so much for your time, Dr. Evita. And thank you once again for all the great work that you have done. And there is no stopping with full energy. I saw you the other day standing and giving a super energetic lecture for 1 hour. So yeah, super excited to see all the new initiatives that you're also going to launch. Thank you so much for your time today.
Not at all. Thank you for the privilege. Thank you.
Thank you.